So I think the barriers to providing effective feedback come down to our own personal barriers to feedback and the barriers of our systems. So our personal barriers would include our concern of popularity as a teacher. Are we going to be perceived as being too harsh or too critical as a teacher? And will that impact our ability to win teaching awards? You know, the system barriers are time. You know, we're pressured to see patients. You know, we also have the pressure of a system that may not teach us well how to give feedback or what to look for in terms of opportunities for feedback. So I think that is a challenge, you know, figuring out what are the opportunities. And I try to divide this into micro skills or micro opportunities. So to give a few examples, as we walk into the room, is everybody practicing hand hygiene? How do we position ourselves at the bedside? What is our physical posture at the bedside? Do we introduce ourselves to the patient? Do we touch the patient? How do we examine the patient? Are our exam techniques correct or effective? You know, how are we interacting with patients? What types of questions are asked? How do we summarize a plan for patients? So there are lots of different micro skills to look at. It's not essential to look at all of those at one time. Pick out one or two that you're going to practice with over a course of a day with a team. Give them some warning ahead of time. I'm going to be looking at our physical presence. I'll give you feedback about that, and we'll try to improve that over the course of rounds. So I would separate feedback at the bedside into things that you can do that are very low inference, you know, helping correct a physical exam technique, helping to make sure that we actually hear the crackles on lung exam. Those are things we can do in real time at the bedside. Potentially giving feedback about types of questions is possible at the bedside as well. And indirectly giving feedback about a plan of care that the learner has outlined for the patient where you correct or change the plan of care. The other aspect of feedback really is outside the room and away from the bedside, but coming back to those micro skills and saying, I noticed that you did this very well at bedside, and I would like to see this continue as we go through the course of the rotation.